Value-based care is touted as a solution for high costs and fragmentation, but it's usually focused on primary care, even though most costs are accrued in specialties. So what does value-based care look like for high-cost specialties, and who's making it happen? Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the Health Biz podcast, where I interview top healthcare leaders about their lives and careers. My guest today is George Aloth. He's co-founder and CEO of Chamber, which empowers cardiology teams for value-based care. Do you like this show? If so, please subscribe and leave a review. George, welcome to the Health Biz podcast.
Thanks, David. Appreciate you having me here today.
Let's talk a little bit about your background and upbringing. I'm interested in what your childhood was like and if there's been any childhood influences that have stuck with you through your career.
Yeah, David. So I was born and raised in Baltimore, and actually I consider myself lucky. I've spent my entire life in this Northeast corridor, so between DC and New York, which I say is the epicenter of everything that's going on in the country. I grew up in a really diverse area, got to see it all. And when you're in this part of the country, because it's such a condensed small space, you can go a few blocks. You're around the richest of the rich, you're around the poorest of the poor, and you kind of see it all. And I really did see it all growing up. And I think that had a big influence on me. It really made me think about, when I get older, I really want to do something that's meaningful. I got to see a lot of folks that really struggled in all aspects of life, but also in healthcare, which is the space that I'm in today. And that's really driven me to do what I do today.
I saw in terms of your educational background, it's a little different than some of the other healthcare entrepreneurs and executives I have on the show. You studied accounting, and then you did law and an emphasis on insurance law. What was your thinking in terms of your education?
Yeah, like all kids growing up, I really had no clue what I was going to do. The one thing I was sure about is that I wanted to move to New York City. So, coming out of high school, you went to Fordham University in New York, and it was intentional. So, for me, my mantra going into that was, make the most of your situation. Whatever you're doing, make the most of it. And Fordham was my top choice, but it was an amazing experience. Really enjoyed my time there. And what I did when I got there was really experience life in New York City. So, I worked 20 hours a week the entire 4 years of college. I got a chance to intern at hedge funds and financial firms and even Sony Records. So I really got a background in what it was like in New York. And I'll say this, where I really learned how to hustle and I really learned how to grind. It was quite an experience moving to New York at the age of 18. But I majored in accounting. I was good with numbers. My dad was a CPA. And for me, I really wanted to do something bigger. For me, accounting was sort of that plan B. Things didn't work out. And luckily for me, things did.
That's great. And then early career, I saw that you worked for, I think, Clifton Larson Allen, a Medicare a contractor, and then was at Cigna, I think, doing compliance as well. What was that early experience like?
Yeah, so once I got to law school, I packed my bags. I moved down to Philly, and it wasn't a top tier law school, but they were very good at healthcare law. So, like my mantra, making the most of my any situation that I'm in, I really leaned into healthcare while I was in law school. So once I graduated, my first gig was working for CMS, which is the Centers for Medicare and Medicaid. And I really specialized in Medicaid and Medicare services, and I really have spent the majority of my healthcare career doing just that. From there, I went to Cigna, where I was also doing Medicaid and Medicaid work. And then from there, I ended up going to a startup, which was kind of this interesting experience. It was one of those moments of, are you sure you're doing the right thing? But it was an amazing experience. I was an early employee at a Medicaid insurance company. And that's where I really learned the space really well. And I would say, one, learning healthcare, but two, learning about entrepreneurism. And it was an amazing experience. I spent 7 years doing it. I learned from one of the best, the founder and CEO, a guy named Tommy Duncan. Really taught me a lot about the healthcare space, but also how to be a good entrepreneur. So I did that for a number of years and really honed my skills. And at one point, we were acquired, and that's when I got my first opportunity to be CEO. CareFirst, Blue Cross Blue Shield had acquired us. They asked if I would stick around post-acquisition to be CEO of their Medicaid division. And it was a wonderful experience for me, and it's been off to the races since then.
Outstanding, George. So after you were doing that at CareFirst, then there was Somatus. So what was Somatus?
Yeah, so after a number of years at CareFirst, I really started to think about what was next. As a health plan CEO, cardiology was always the most expensive thing in my P&L. And so I really started to think about the specialty space and value-based care, things like that. So I ended up leaving. I went to Somatus, which was a large premier kidney value-based care company, really wanting to learn about specialty value-based care. That the space in nephrology was really baked, and I thought I could learn a lot there. So there, I went there in a group president role, was managing most of the country, that's when I really started to think about this next idea. Value-based care had taken off from primary care, but really only certain specialties like nephrology and oncology at that point. Again, thought there was this huge opportunity in cardiology, and eventually ended up leaving there to start this company.
I mean, as you say, heart is the big one. It's not just some random specialty. So as big as, kidney care is in oncology, heart is certainly bigger than nephrology, and it's right up there with right up there with oncology, if not above. So, what did you see in terms of why value-based care in cardiology? Because other people knew that it was big, but maybe they were thinking it's just not a place you can do value-based care.
Yeah, I think if it was easy, everybody would be doing it, right? I think there's challenges, but the opportunity is there. It's the biggest expense in healthcare. It's the number one killer in America. I think that, typically in value-based care, they really followed CMS, right? So there was programs for primary care, then there came programs for kidney and oncology, and that's really what drove the marketplace. And I think that because there were not programs, fully fledged value-based care programs for cardiology, there was a slower adoption rate. I think what we're seeing today is that the problem is just too big to ignore. The spend is out of control. The outcomes for patients with heart disease are not getting better. And really, there needs to be a solution. And I felt, it's going to be hard. It's different. There aren't a lot of people doing this, but the opportunity is there, and someone needs to do it. And so that's what really drove me to start this company.
One of the ways that value-based care can work is by having care be coordinated, which is a reason why you often see it in primary care, even though that's not where most of the cost is. Primary care can be the quarterback. But healthcare is so fragmented, and I'm wondering, if care can really be coordinated and how you can actually hold anybody accountable, say for a cardiology patient.
Yeah, I think that the most important thing in value-based care and healthcare in general is engagement, right? The only way it's going to work if everyone's engaged. And I think that the second part of that is really collaboration and connecting those dots. And so if you think about any patient, there's the patients themselves that have to engage, but there's the doctors, there's the health insurance company, there's the other specialists that may be involved in the patient's ecosystem of care. And I think that when you think about the population, there's not one solution that makes sense for everybody. There's some people that make sense for primary care, value-based care. There's some that make sense for specialty. And I think that there's a large portion of the population where their care is really dictated by the cardiologist, right? Once you have heart disease and it's far enough along, you may not be thinking about those other things. You may not be thinking about primary care or other issues that you may have because your biggest concern is your heart disease. And so I think for that portion of the population, our argument is that cardiology value-based care makes sense for them. The cardiologists and our care team and Chamber in general, our solution really should be the quarterback for those patients.
So as you mentioned, heart disease is a top cause of death. It's a big expense in the healthcare system. You've got these expensive patients. At the end of the day, is there a strategy for these advanced patients in terms of cost and quality? Is there anything that you can actually do about it if you focus on it?
Yeah, there's a lot that we could do about it, and that's what we're working on. I think, there's a lot of low-hanging fruit there, right? There's inertia when managing these patients. A lot of times you see cardiologists that are seeing 30, 40 patients a day. It's hard to really manage them. We work with practices all over the country, and sometimes we'll talk to doctors and say, I'm seeing 30 people tomorrow. I actually don't really know, who has what and what their conditions are and things like that. And that's where we come in. So we help first stratify their patients, understand who are the patients that need those extra touch points. Are they, we think about GDMT, are they on the right medications? Have they had the right titrations of medications? We think about site of service. Are there things that could be done in a more simple environment versus going to a facility? And a big part of it is just keeping people out of the hospital, keep people out of the ER. A lot of times folks will use the ER as their doctor, which doesn't make sense and it sidetracks their whole health voyage. And I think for us, we really want to manage that more holistically. So the technology and the data and really supplementing those gaps that cardiology practices have today, we really think is the solution in improving heart disease.
So help me understand from the perspective of a patient. Let's say I'm a patient with serious heart disease. What does it feel like? What is my experience like in a practice that you're working with compared with the sort of typical unmanaged practice, or where you've just got the traditional cardiology approach, or maybe a patient is actually going to the emergency room, as you were mentioning before?
Yeah, I think we really drive ourselves on having a more positive patient experience, and I think it starts with the touch points, right? Not all the cardiologists themselves don't always have time to engage with all their patients. They're busy, right? So part of this is where can our care team come in? What kind of education and counseling and support can they provide outside of the cardiology practice? So that's one really, important part of our model. I think another important part is wait times, right? So we help stratify these patient populations for our doctors, meaning it breaks my heart when you hear, some people have 6-9 month wait times just to see a cardiologist. And that's a big part of why we're doing our solution is make sure these folks are seen, whether it's in a virtual setting, whether it's by a care team member, or whether it's just elevating the urgency on their appointment so they can get into the practice. These are some of the things that the patient experience is much better, especially when they're really concerned about their heart disease.
When you talk about those sort of wait times, which I hope aren't typical, but I can actually understand how that may occur. It seems nuts because we spend so much money on healthcare in this country, and unless people will say, well, we spend a lot, but I'd hate to be like in another country because they have rationing of healthcare. I mean, what's the why is there such poor access, including for patients that have insurance?
Yeah, I think part of the problem, the biggest part of the problem is so many people have heart disease. So if you think about our space, does the demand meet the supply, right? There's only so many cardiologists out there. I think the other part that is concerning for us is that there's a disproportionate share of cardiology services, meaning for a lot of the vulnerable populations, do they have to travel across town to get to a certain cardiologist because there aren't cardiologists in their neighborhoods? Are there certain cardiology practices that won't see certain populations? There's a lot of dynamics that we're trying to solve for. In the end of the day, there's a bandwidth issue. And I think that's where solutions like us come in. We have to supplement these practices. The doctors are doing fantastic work. They just need help, right? There's lower level of services that other folks can be doing to support these practices. There's other things that are technology and the data and all that stuff will help with. And that's really what we're aiming to do here at Chamber.
George, did I hear that right when you were saying there's some cardiologists that won't see certain populations of patients? Did I hear that? And what do you mean by that?
Yeah, I mean, there are some cardiology practices that may not see Medicaid patients, or they may only see commercial patients, right? I think, practices are so busy that sometimes they themselves have to prioritize economically which patients they're going to see. And so that's why we really want to help with that and say that all patients are equal. Everybody that has heart disease should get the same level of treatment no matter which doctor they're seeing or which insurance that they have covering them. And so that's really what we're looking to solve for.
Got it. So even if Medicaid is going to pay less, then you're still going to make sure that those patients are seen by making it more economically feasible, at least for the physician, if their practice is where they're busy as it is and they don't want to take a money losing patient, and you make it so that they can see them efficiently and not lose money. Is that fair?
Yeah, that's fair.
Good. All right. Well, I'm glad someone's looking out for the Medicaid patient. I want to ask you a final question that's not necessarily, it could be related to what we've been talking about, but maybe something totally different. And that's whether you've had a chance to read any good books lately, anything you would recommend to the audience, or conversely, if you read anything bad that you think we should avoid, let us know about that.
Yeah, David, between trying to grow this company and I have 3 little kids under the age of 8, I don't do as much personal reading as I used to. I spend a lot of time reading children's books with my kids. But, one book that I did just start, Jim Collins' From Good to Great. And, a lot of really valuable lessons in there that I've been picking up, especially at the stage of the company that we're at. And one of probably the main ones is, focusing on the who, not the what. And it's something that I think about every day when we're building the team and we're trying to build this solution is you have to have the right players. And I think about life, if you got on a bus and you thought the bus was taking you to Miami, but the bus ended up taking you to Iowa, would you care? Well, if you have the right people on the bus, you guys are going to have fun regardless. And I think about that a lot as we build the team. We're going through some pretty rapid growth at Chamber. So it's been a good read that I've just gotten into recently and a lot better than some of the children's books I've been reading.
I have had some people recommend a children's book like Goodnight Moon. I haven't heard anybody recommend the one. I think there's one something like Everything I Needed to Learn. I learned in kindergarten or something. But I think that the Jim Collins one is a better choice. Well, George Aloth, co-founder and CEO of Chamber, thank you for talking to me today about cardiology, value-based care, and your life's journey.
Thanks for having me, David. Really enjoyed it.
You've been listening to the Health Biz Podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.